When we think of intelligence and neuropsychological assessment, we often picture carefully designed tools meant to measure cognitive functioning, don't we? Things like the WAIS, the Wechsler Adult Intelligence Scale, or the MMSE, the Mini Mental Status Exam. But what if I told you these assessments, while valuable, often fail to capture real-world complexities? In this lecture, I'm going to take you on sort of a little journey through 5 underappreciated aspects of these assessments that should challenge the way that you think about interpreting results. Okay? So, first, I want you to remember that there's a cultural and socioeconomic bias in intelligence testing. Now, your textbook does talk a little bit about this. And as your textbook notes, intelligence tests are not as culture-free as we might hope. Many were developed within that Western middle-class framework. This means things like language and educational background and life experiences, they all skew the results. A prime testament of the influences of our intelligence is the Flynn effect. This was named after researcher James Flynn. He showed that IQ scores have steadily risen across generations over the decades, but not because humans are suddenly more intelligent. Instead, it appears that environmental factors like improved nutrition, better health care, and increased exposure to technology, all of those kinds of things play major roles in this. So there are some key takeaways of this cultural and socioeconomic bias that I want you to consider and remember, okay? If IQ were purely genetic, we probably wouldn't see such a rapid increase over just a few generations of IQ scores, would we? Also, it seems like early intelligence tests favored those with formal education, right? So maybe past low scores reflected more of a lack of exposure than lower intelligence. And also think about this. In more recent years, the Flynn effect is actually slowing in some developed nations. Now, we think this is possibly due to changes in things like education quality, unfortunately, lifestyle shifts, and a scary one for me, an increased reliance on AI for problem solving. It's making us dumber. So here's the big question then. Are we truly measuring intelligence, that construct of intelligence, or are we just measuring exposure to certain learning experiences? Time will tell, I guess. Okay, number 2. This is what I call the ecological validity problem. So intelligence and neuropsychological tests often measure cognitive abilities in controlled environments, things like the clinic. But the question becomes, do the results of these tests predict real-world functioning? Think about this. A patient can score really well on a working memory test in a quiet clinical setting. But when they get in a noisy supermarket setting, they suddenly struggle to recall the grocery items they wanted to get. So as clinicians using these tests, we should ask, how well do these tests really translate into daily life if we're testing in a controlled environment? This discovered discrepancy has led to a push for what we call functional assessments. Functional assessments just basically evaluate how individuals perform in a real life setting. But I think this is really valuable information. So we're getting information in a real life setting and in a clinical setting. Okay? So number 3, I want you to consider effort and motivation of the client in the testing. So this is an example too where I think clinical judgment probably becomes key. All right? Cognitive scores don't just reflect ability. Well, they reflect ability as we measure ability, but they're also influenced by things like motivation of the client, their fatigue level, their pain level even. You could even consider secondary conditions, like if they're suffering from depression at the time. So in forensic and disability evaluations, for example, some individuals may even underperform on purpose, intentionally. Well, we do have some ways to address this. We can use performance validity tests. We call them PVTs. Performance validity tests are measures designed to detect effort levels, basically. However, even in clinical settings, when we use PVTs, we must always evaluate, is this score reflecting true ability or is it something else? And that's why I say clinical judgment becomes paramount here. All right, number 4, intelligence and neuropsychological scores are not fixed over a lifetime. Many people assume an IQ score and cognitive scores in general, they're just static. And you and I know, because we're educated in this, right? The brain has neuroplasticity. That means cognitive abilities can improve, and they improve with things like training, rehabilitation, or even environmental changes. For example, stroke patients often show really poor verbal fluency immediately after the stroke event, but they can regain function over time. So what does this mean? This means that it's a good reminder that assessments should be dynamic, not just a one-time snapshot. Okay? Okay, number 5, there is a neurodiversity versus deficit model debate going on right now. Okay, what do I mean by that? Well, traditionally, assessments focus on deficits, what a person cannot do. After all, isn't that why most people typically come in to be tested? Yeah, they typically do. But there is a neurodiversity movement going on right now that challenges us to think a little differently. So it goes like this. Instead of viewing conditions as impairments, conditions like ADHD, autism, or dyslexia, for example, the neurodiversity movement says, we should also consider the individual's strengths. Let me give you a couple of examples. Someone with ADHD may struggle with executive functioning. True. But they could excel in other things like creativity and innovation. Or think about an individual who has autism. They might find social interactions challenging. True. But they could also demonstrate exceptional pattern recognition and problem-solving skills. I was in an art gallery in Galena, Illinois, just a few years ago. There were these 3-dimensional photographs hanging on the wall in this art gallery that I went into. They were fascinating. They were done by a guy who was autistic, and he had taken these photographs and layered them on top of one another, each on a piece of metal, so there was some dimensionality to the picture. I paid $200 for one. That's how good they were. And I don't spend that kind of money unless it's something really special. What I want you to know that's important about this neurodiversity movement is that it promotes self-efficacy, it promotes accommodations and societal change to foster inclusion rather than just remediation, right? So as future clinicians, let's ask, are we diagnosing deficits only, or are we also recognizing strengths? So in conclusion, I want to say, intellectual and neuropsychological assessments are powerful tools, no doubt about it. But like everything else, they have limitations. Cultural bias, real-world applicability, motivation, neuroplasticity, shifting diagnostic perspectives, they all influence how we interpret results, right? And as clinicians and researchers, we need to go beyond simply scoring a person. And I want you to instead remember to ask yourself, what do these results actually mean for this person's life when you're doing an assessment? Now go read the chapter with these things in mind. Okay?